Good morning, everyone. I am Dr. Angelo Austria, and in behalf of St. Luke's Medical Center, Quezon City, and the Institute of Orthopedics and Sports Medicine, I would like to welcome everyone to our lecture series with a special topic today on fall injuries. So let me first introduce to you my consultant, Dr. Andrew Taberrah. He is an orthopedic surgeon with training on adult hip and knee reconstruction and is the head of the Center of Joint Replacement Surgery here in St. Luke's, both in Quezon City and in Global City. He is also the assistant head of the Institute of Orthopedics and Sports Medicine here in St. Luke's, Quezon City. He will be our moderator for today and will be answering all of your queries at the end of the presentation. So before I start the presentation, this video will be posted both on Facebook and on YouTube page as well. And before I proceed, I would like to also invite you to the subsequent Basic Emergency Practice lecture series. So without further ado, let me start our presentation on fall injuries. Good day. We welcome you to this live forum delivered by the St. Luke's Medical Center, Institute of Orthopedics and Sports Medicine. Alright, sorry about that. Let me just check my connection. I think the audio is not functioning. Share sound. Alright. Okay. Good day. We welcome you to this live forum delivered by the St. Luke's Medical Center, Institute of Orthopedics and Sports Medicine, discussing on the topic of fall. Let us look at these scenarios. First, the kid is playing with his bike, then suddenly he landed and broke the fall using his right wrist. The next is an elderly slipping and falling, landing on her buttocks. Both scenarios appear to be simple, but ground level falls in special populations can cause debilitating injuries which may need medical and surgical consult. So, a fall is an event which results to a person coming to rest inadvertently on the ground or on the floor. They can either be a low energy nature of injury or a high energy type. The most common injuries that are sustained from falls occur with those from a standing height or a fall from an outstretched hand, both of which are low energy mechanisms of injury. High energy mechanisms of injuries, on the other hand, are sustained usually from falls from significant heights or more commonly from motor vehicular accidents. All individuals can sustain a ground level fall. However, the elderly population are those who have a higher risk due to multiple factors, including intake of multiple medications, their generally weaker strength, their impaired mobility, and the exposure to environmental hazards. What can happen after a fall? After the traumatic event, the patient can have several injuries depending on the mechanism. That can range from head trauma, abdominal and chest injuries, open wounds, and of course, fractures. Fractures are defined as a break in the continuity of the bone after a deforming injury. These can present with symptoms of obvious deformity, severe pain causing inability to walk or move the affected part. In the elderly population, the most common fractures caused by fall include hip fractures, distal radius fractures, and fractures of the vertebra, which can present with inability to weight bear on the affected hip wrist pain, and back pain, respectively. So, what do you need to do when you encounter a patient with a fall? The patient needs to be surveyed for any signs of head trauma, which could present with loss of consciousness, seizure, or vomiting. Aside from head injury, the chest and the abdomen can be affected too, which could present with difficulty of breathing as well as pain. If a fracture is suspected, look for associated injuries by having the patient localize all areas of pain. Check for open wounds, abrasions, or puncture wounds. Do not further manipulate the injury unless there is an ongoing bleed. For areas of active bleeding, apply pressure over the wound with a clean compress. As for grossly deformed extremities, immobilization should be done in the position that the extremity was witnessed. Again, do not manipulate or attempt to straighten the deformity, as this can cause further problems if not professionally supervised. Immobilization is to be done via splinting. We can apply a hard, long, flat object that spans the extremity as a first aid, usually a plywood, hard plastic, or cardboard, then fix it to the extremity using a bandage, cloth, or tape. Apply pressure to the open wound to minimize the bleeding. If you have suspicion of a head or neck injury, lie the patient flat and avoid neck manipulation or movement. In patients with suspected hip injury, do not allow them to walk or weight bear until seen by a medical specialist. When then should you bring these patients to the emergency room? These are some of the following signs to do so. If the patient presented with significant pain or discomfort that cannot be managed at home, if there are signs of head trauma, if there are associated symptoms which could have caused the fall, such as sudden loss of consciousness, dizziness, weakness, lightheadedness, or blurring of vision. And lastly, if there is significant cross injury such as bleeding, open wounds, or obvious deformity. The patient should be immediately brought to the emergency room to be assessed and adequately managed. However, if in doubt, bring the patient to the emergency room for proper evaluation. Lastly, what we want is to prevent these injuries, and these can be avoided by avoiding slippery floors, using hand or side rails as necessary or appropriate assistive devices. Maintain a safe distance to avoid falling when driving a motor vehicle, and always supervise children. Thank you and stay safe, everyone. All right,
Thank you
so we
very much.
will. All right, so we will now be opening the chat box for any questions from the audience. So, does anybody have any questions or any concerns with regards to fall injuries?
Since there are no questions as of the moment, we would just like to remind the viewers that this can be viewed again in the official Facebook page of St. Luke's Medical Center and also in their YouTube channel.
Okay, I think nobody has any questions, Hooser. I think the lecture was clear. Let's just wait for a few minutes if anybody would like to raise their hand or ask any questions. So let's give them a couple of minutes for that.
Okay, thank you.
Okay, sir, we have a question from Oniel Aquino from Batangas Medical Center. I would just like to ask what will be the basic aid if a geriatric patient will have a hip injury?
Okay, thank you for the question, sir. So usually most of the geriatric patients usually fall from a standing height, and most, if not all, usually are unwitnessed falls. So you'd want to check the overall overall status of your patient, make sure there's no head trauma. And usually whenever the patient falls on one side of his or her body, you'd usually want to also check the other aspects on the same side. Let's say for the hip, you want to check the knees, that side of the chest that the patient fell on, and also the upper extremities and the shoulder, for so we won't miss any concomitant or associated injuries. But normally they would usually have difficulty sitting up or even actually standing. And normally if you have a hip injury, you'd usually have a groin pain. It's not usually the pain behind the buttocks, which normally people associate with the hip, but normally a true hip injury, you'll also have the patient note that there's pain in the groin. And usually if you have a hip fracture, you'll notice that the position of the affected leg would usually be more rotated externally than normal. Parang naka-de-quattro halos yung patient, because that will be the pull of the muscles which are attached to the bones, which cause the deforming forces. So normally when you see a patient like that, just try to do gentle palpation. Don't do much range of motion if the hip is involved, because sometimes you may have an undisplaced fracture, which would require more minimal invasive treatment compared to a displaced hip injury, which might require fixation or actual hip replacement. So I hope that answers the question from Mr. Aquino.
Great, thank you, sir. So we have a next question. We have a participant from Australia, Mr. Jasper Aubrey. How would you assess the neck and the spine?
Okay, that's a good question. So for the neck, usually one of the things that you would want to note is if it's just like a whiplash injury or you hit the head, which causes strain on the neck, try to ask the patient to try to do gentle range of motion on his or her own. You don't want to do any manipulation, passive manipulation, because normally injuries can range from slight muscle strains, and if it's a high energy injury, it could also have a dislocation of the spine, which could cause issues with the spinal cord. And normally you would want to ask the patient if they feel electric sensation down their upper extremities, or they have some weakness or loss of sensation, because those are the telltale signs that maybe a nerve in the spinal cord is involved. So that's one of the things. If the patient can ambulate, then that's good, because at least the spinal cord will be most probably intact. But the best is try to put a collar if there's something available or any support, and try to feel for the back. You can feel for the back of the neck. There are bones that you feel. Those are the spinous processes that we call in the spine. Tenderness will also probably indicate some bony pathology, or hopefully just a muscle strain. Most of the time, these could be verified by x-rays and, if needed, CT scans or MRIs after clinical evaluation by a physician. I hope that answers the question from Mr. Aubrey.
Okay, thank you, sir. So for the next question from Ma'am Jennifer Malana, this is probably in relation to the previous question with regards to a geriatric patient. So what is the first thing to do for a geriatric patient who had a fall but said he or she is okay?
Okay, thank you for the question, Ms. Jennifer. So one thing that would make you think that the patient probably has a mild injury is, one, if they are able to sit up. So most of the patients with a hip injury or a fall, when you say a fall, Ms. Jennifer, are you pertaining to what area of the body, or is it the body in general? So we'll try to wait for her answer, but I'll discuss in general. So for falls, it depends on, you try to ask the patient where she hit herself or he hit himself. Try to see for any bruising, because sometimes even if it's a low energy trauma, geriatric patients get to bruise more easily. So try to feel for all parts of their extremities on both sides and try to just do gentle palpation or press on the certain areas of the bone, because pressing areas of the bone all over the body surface will at least tell you where the point of contact with the fall occurred. And normally, one way to test if the patient is really okay is if you move the extremities gently in their ranges of motion. Like for the arm, you do a flexion extension or try to pronate and supinate their arm. For their shoulder, try to gently move it around. If there's no pain, then most probably there isn't any bony issues. For the hip, if you can rotate the hip or move it around the socket by lifting the leg into 90 degrees, then you could also gauge whether it's just a soft tissue problem. Because if it's a bony injury like a fracture, the pain will be too excruciating for the patient to tolerate. The same goes for the other parts of the body for both sides. So hopefully that addresses the question. If most of the time the geriatric patients, if their mental status is intact and their cognitive function is okay, they'll be able to answer any assessment done at home, even by people around them. So just try to do those maneuvers to get some information. If you're unsure, just like what the video said, it's just best to bring the patient to the hospital just for an X-ray screening and also an evaluation by any medical physician in the ER who can do an initial evaluation. I hope it answers your question of Miss Jennifer. Thank you.
All right. So we have a next question from Mr. Patrick Henry Lazaro. So good morning, sir. So is there a way to move a patient with hip injury in case the area of the incident is not safe?
Okay. So ideally, you'd want to put the patient on a flat surface, like a stretcher or any makeshift bed which we can lift, because it's hard to lift the patient like one on the shoulders and one on the legs, because it will cause more pain on the hip. Better to have something holding the hip in a stable position as well as for the legs. So if there are many people, yes, you can move the patient. I think whether or not, let's say there's a fracture, whether we can cause more displacement of the fracture, I think that's something that we'll just end up having to deal with at a later time, because you'd want to secure the patient's safety first. Just make sure that she doesn't or he doesn't have any neck injuries as well, because you don't want to cause undue manipulation of the neck. So you'd want to give support in the neck, in the lower back, and the hip, as well as the legs when you transport. So yes, you can move a patient, but try to exert as much support as you can with the patient lying down, because unless the patient can tolerate a sitting position, then that's an easier logistical issue to deal with. I hope it answers the question.
All right. Okay. Thank you. So for the next question, we have a question from Ma'am Cheryl Suarez. Hi. How do you differentiate strain from sprain upon assessment?
Okay. So the strain or a sprain, usually you'd see it mostly on the more mobile joints. Usually when you have an ankle sprain or a knee sprain, normally a sprain causes more damage in terms of the ligament tears because of the severity of the injury. Meaning to say, we all get sprains from time to time. We natatapilok tayo when we walk on uneven surfaces. But if your ankle, so to say, for that example, if your ankle doesn't develop any swelling and you're able to walk with it without significant pain and you're able to do all the activities, then most probably that's what you call a strain. But on a clinical picture, when you look at the extremity, it's really hard to determine a strain from a sprain unless you do some imaging. But some of the telltale signs of whether significant functional impairment is present, like from a sprain, that you get severe swelling immediately, patient is having a difficult time walking on it. That would be more on the sprain, because the sprain is something just like a stretch of the ligaments and muscles which cause some initial pain due to the trauma, but you're still able to retain some level of function. So hopefully that answers Miss Cheryl's question. And I think there are other questions there.
Okay, from Mr. Paulo Cruz, how do you handle broken ribs and subsequent injuries to the internal organs like the lungs?
Okay, so most of the time when you break the ribs, we normally don't do anything. We don't operate on fixing broken ribs because they usually heal on their own. But there are incidences where many ribs on both sides are broken, which causes what a condition called as a flail chest. And sometimes with the significant trauma in that area, it also causes injuries to the lungs, wherein x-rays can see whether there will be air or fluid buildup inside the lungs. So normally, general surgeons or emergency physicians can handle them immediately when the patient has some difficulty of breathing. Other than from when you have broken ribs, it's difficult to inhale and exhale because your chest wall moves with each inhale and exhale. And there are muscles attached to the ribs that when you try to stretch or just lift your arm, it will cause some pain. Even with coughing and sneezing or laughing a little bit, it will cause some strain because of the movement of the chest wall. But normally, broken ribs heal in 3 to 4 weeks, and we only give medication to support the pain. No need to do any immobilization, unlike historically, people would be strapped with a bandage right around their chest, which is tied up very tight, which causes more difficulty in breathing for the patient. So they'll end up having more pain because they'll try to exert more effort just to do a normal breath. So, but normally it doesn't cause significant injuries to internal organs unless the force that came through is very massive, which can cause multiple rib fractures. So, if they have difficulty of breathing, best to bring them to the emergency room to check if they have what you call a pneumothorax or too much air in the lungs, or a hemothorax, which is some bleeding in the lung area, which can be drained by putting a chest tube. Okay, Barry, thank you.
All right, so we have another question from Sir Oniel Aquino.
Yeah,
How
I
can
think
we assess? Yeah,
yeah,
apa.
patient has sprain or tendonitis. So as I
Yeah.
mentioned earlier, the sprain is more on the joints. It's more of a stretch of the ligaments or actual tears of the ligaments. But most of these ligaments usually could be treated with supports and physical therapy. And normally, if you're able to move your joint, like your knee or your ankle, and able to put weight on it, then most probably it's just a sprain and no fracture. Tendonitis is a different issue because tendonitis is an inflammation of the muscles attaching to the bone. So when a muscle attaches to the bone, it's called the tendon. When a structure connects bone to bone, that's what you call a ligament. So those are similar in structures with collagen fibers, but they have different attachments and structures associated with their function. So with the tendinitis, it's more associated with when people move certain extremities and they cause pain. And this is normally on the elbow, on the shoulder, and also in the knee. They both can cause pain during exertion or movement. It depends on the severity of their injuries. So an actual good physical exam where you palpate and try to move the extremity or the joints involved in the directions in the ranges of motion that they are allowed to check for the integrity of the ligaments. And then you can facilitate treatment, whether with medication and supports and subsequent physical therapy as necessary.
Okay, so next question, we have a question from Ina Geraldine Madalag. What is the first thing to do when a geriatric patient falls and hits their head? Thank you.
Thank you. Uh, One thing, hopefully, when a geriatric patient falls and hits their head, hopefully it's a witnessed fall because most of it is unwitnessed. But if case you see it, or in most cases when you don't see it, try to feel for the whole head area from front to back to see if there are any lacerations or any bleeding or any soft tissue injuries, no? Because you'd also want to make sure that we won't miss anything, especially sometimes they can get a cut behind the back and it's full of hair, and sometimes we miss those areas. So you want to do You do want to do a physical inspection by palpating the head. You want to feel the back side and the front side all the way to the base of the skull. Next is you want to make sure that you check their level of consciousness. If they're awake and they can answer questions, they know where they are, they know who you are. It's like a mini mental status test. Just like what was mentioned earlier in the video, hitting the head will also cause some subsequent injuries to the neck. Don't try to manipulate or move the neck, and don't try to move it up and down. Just try to feel the back if there's pain also on the cervical spine. And next, you'd ask if they're dizzy or if they feel nauseous or they feel like they're gonna vomit or they have severe headache, because those are some signs of some what we call a brain contusion or what you call a cerebral concussion. And you want to make sure that also they don't have any bleeding inside the brain, which can manifest as severe headache, because those are things that should be managed immediately and referred to a neurosurgical physician for evaluation if any further intervention is needed.
Okay, thank you, sir. So currently we have no more questions. So let's just give a few more minutes. Probably let's just wait for other participants if they have any other questions.
Okay, thank you, Mamina. Yeah, Bear, so we'll just wait. So
we'll probably give around 1 to 2 minutes, and then if nobody has any other questions, we will end the lecture. But we'll allow a couple of more minutes for those who have any other questions. Okay, I think we have no more new questions, so I hope everybody learned a thing or two with regards to fall injury. So, in behalf of St. Luke's Medical Center, we would like to thank Dr. Andrew Taberrah for your participation and for moderating this lecture for today. And also, to remind everybody, we would like to invite you to our subsequent lecture series as part of the Basic Emergency Practices lecture series. We will be sending the link thereafter. We'd like to invite you for our next lectures. And thank you everybody for your participation and for joining our webinar, and have a good day.
thank you, everybody.